PRP stands for Platelet Rich Plasma. And even that probably doesn't make sense to most patients, so just to explain what it is, we take the patient's own blood and then you put it through a process which is called basically centrifuging it. You spin it around. And what that does, it nicely separates the bloods into different components. So you have the red cells, the white cells, the platelets, and the plasma. And even the plasma has different grades to it. We are designed in such a way that when we injure ourselves, we heal. So something very simple like, for example, tennis elbow, in fact, at microscopic level, is an injury to your tendons on the outside of your elbow. Now we know that given enough time, good physiotherapy sometimes on top, can solve most of the problems. But there are people that still, despite time and good physiotherapy, don't heal. So what PRP does is what we call a group of substances called biologics. What it does is enhances the healings, makes it heal faster. And the way it works is that you take your own blood, concentrate the growth factors and other substances within those cells that promote healing, and you inject it in an area where there is low in growth factors, which needs it, to allow it to use those growth factors and then heal faster. As you know, I am an upper limb surgeon. I do shoulders and elbows. And I tend to use it in shoulders and the elbows. And in elbow, the biggest place to use it is on the outside of the elbow for tennis elbow, also known as lateral epicondylytis or lateral epicondylar tendinopathy. But in layman's term, tennis elbow. It is one of the commonest uses of PRP. And why again? Because we know that literature has showed that steroids that are currently used are not as effective. In fact, there is evidence out there that steroids in most cases only have a short-term effect. And you come 3 or 4 months later and beyond, the problem comes back and occasionally comes back as worse.